Welcome, my friends, to the Bob and Brad podcast. My name is Mike Kienitz, and I'm a PT assistant. Today, I am interviewing Dr. Abbasi, who is one of the nation's leading spine surgeons. He works for Inspired Spine, based out of Minnesota, but they also have locations other places throughout the country. He specializes in minimally invasive spine surgeries and was one of the most experienced surgeons that performs the OLLIF procedure. He is also the only surgeon currently performing the minimally invasive thoracic interbody fusion. So without further ado, here's Dr. Abbasi. Would you mind explaining to our audience what the difference is between these three type of back surgeries I'm going to list? So the first one is microdiscectomies, a disc replacement, and the OLLIF lumbar fusion.
Yeah, absolutely. I love to. Now, we talked about the tire of a car, that our spine is like a tire of a car. Imagine if you have a flat tire, you might have one hole in that tire. And then, or part of the disc or part of the content of the disc is bulging out. Microdiscectomy is more comparable to patching that tire. Going there, what part of the tire that pushes out or what part of the disc that pushes out against the nerve causing symptoms, we go and trim it. Many times we follow the hole because inside of the disc, contrary to a tire, is not air. Is soft, very soft tissue. We call that nucleus pulposus. It is something that looks like a crab meat, something that is soft jelly-like. And in a microdiscectomy, first of all, we make an incision, we go to the bone, we cut, we make a window in the bone to get access to the disc base. Once we have access to the disc base, we remove the part of the disc that has come out of the disc and pushing on the nerve. And most of my colleagues and I myself, we then follow the hole that where the material came out. And we go inside of the disc, we remove the loose part of the disc. So next time patient stands up, not more material comes out. And this is a very effective treatment if practically you're a young person, you have one hole in the disc, a piece of disc material came out, pushed on the nerve, but the disc integrity is overall intact. Especially if the leg pain is the main symptoms, this can be a very effective way of treating the symptoms and the disc. If the disc has like 10 holes, the whole disc is slashed open and the back pain is much worse than the leg pain, it still could be an option in certain situations, but then we have other options that are probably more suitable.
So what would be you want to describe a disc replacement?
Absolutely. See, a disc is like a joint, like something that separates two bones against each other and make them move against each other. We have other joints, like we have joint in your knee, we have joint in your hip, and everybody knows about the disc replacement for those joints, like a knee or hip. They are very common, very routine procedures. Now, comparing to the spine, those joints are simple joints. Especially the way we look at them, those are joints that the center of the motion in the disc, in the joint is fixed. Spine has actually not a single center of motion, meaning that while you're bending forward, the point it pivoting around, it actually moves with it. It's a very complex joint. For that reason, the artificial disc, even though they exist for the spine, they have not become the most prevalent way of treating that. As a matter of fact, we say that spine is a complex three-part joint. Most of the artificial disc in the spine, they replace only one part, and that sort of put a lot of stress on the other two joints, which are the right and the left facet. Naturally, everybody wants to restore the function. And so for that reason, artificial joint in the spine are a big word, and it's a big marketing word, and people really try to say, yeah, we'll replace, we restore the disc. Unfortunately, the technology is not far enough to truly, for us to be able to replace an artificial joint in the spine. Contrary to knee and hip, artificial joint in the spine are very in a rudimentary stage. As a matter of fact, the most recent paper that came out about the artificial disc in the neck, that in this 5 to 7 years, they're equal, not better than fusion. In the lumbar spine, most indications are that they're not as good as fusion. So they're going to improve in the future, but at this point, in the neck, artificial discs are equal to fusion based on all the information we have, and in the lumbar spine, they're not superior, but inferior to fusion. Sometimes the motion is the problem. An artificial disc by design, they keep the motion, and if, for example, your facet, your joint, your bone spurs is the problem, by keeping the motion, you don't fix the problem and the problem goes on. I'm hoping that in my lifetime we make huge advances in this field, and artificial discs become more nature-like. But at this point, standard of the care for when your disc is so bad that needs to completely be removed is a fusion. Fusion has a bad reputation, not because of the result of the fusion, but because of all the collateral damage we surgeon cause when we do the fusion. And the minimal invasive fusions are supposed and are very successful to counteract those downsides of fusion.
So it has been said to wait as long as possible before having any type of surgery. What would be the major red flags to let someone know that they should get a back surgery?
Now, as we talked about, pain is a signal that something wrong. Pain by itself is not the problem, but a sign that something else is the problem. And pain is going to tell us that if you don't take care of it, you will have other problems. So, and that answers your question. Anything beside pain, like all of a sudden you cannot feel your legs, or you cannot move your legs, you have weakness, you have tingling, you have numbness, you have bladder bowel incontinence, you have other problem beyond pain, indicate that your body gave you the signal, nothing really good happened, and now the damage that your body was warning you about is about to happen. So especially weakness and bladder bowel incontinence, problem walking, like balancing and so on. These are signs that your body warned you already, is now the damage that your body was warning you about is about to happen.
What happens when you see people like that?
Yeah, in many cases, thanks God, our technology is so advanced, we still can reverse the process. We can take the pressure off, stabilize the spine, and reverse the process. But sometimes, especially if people have become like incoordinated, they cannot control their hands and arms. We have a name for that. Especially if the pressure is in the area, in the thoracic, in the chest or neck, where the pressure actually damaged the nerves, then there is this picture, we call that myelopathy, meaning that the nerves inside of our spinal cord start to die. Unfortunately, when that happens, that becomes an emergency, and we sometimes cannot reverse that. But many times we can at least stop, halt, or sometimes reverse the process by taking the pressure off the nerve and the spinal cord. In those cases, we just speed up the process, take the patient to the surgery, take the pressure off the spinal cord.
Sure. So that's a good warning sign for any listeners. If you're having those problems, you should get them checked out sooner than later.
Absolutely.
All right. Where can people go to find more information about you and your clinics, and where they can sign up to meet you?
Well, it's actually, if you just put these 5 letters, OLLIF, double L, you will see that 90% of the material in the internet is what we put out there. They have published paper. And if people go to YouTube and put like OLLIF, you will have 1,200 testimonial of patients who have been treated. And I put the average of everything, like literally you can sit in front of the YouTube and go hours down, scroll down, and you see our patient. Put your condition like OLLIF spondylolisthesis or OLLIF elderly, OLLIF spondylolisthesis. You get more testimonials, informational material regarding that. Or they can go to inspiredspine.org or inspiredspine.com, and they get all information regarding us. We get in average about a dozen of patients every week from other states that we go online. And long before people knew about the Zoom and before COVID, we have been having this Zoom and internet consultation helping patients all across the US and even world.